Hi, I'm Tiffany Bush, and this is a clinic minute as I'm wrapping up here at FRL Integrative Therapy, and wanted to take just a moment to talk a little bit about the difference between therapy, coaching, and consulting, because as people will reach out for like a 15 or 20 minute consult to figure out if what I do is appropriate for them, it's really important for me to be able to help them differentiate between which services that I offer that would actually be appropriate. And I think sometimes you don't know exactly what it is that we need from somebody. And I'm cross-trained. I'm trained as a coach a few times over. I'm definitely 10 years deep into training as a mental health therapist. And I am very much a consultant in a lot of ways. And consulting is the easiest place to start from. When you would hire someone like me to consult with from a nutritional perspective, a naturopathic, functional medicine perspective, from the perspective of trying to get change in your life, I'm going to give you more direction and more advice, okay? So I'm going to advise you on what would be best for your health. I'm going to advise you on making decisions for supplementation and food, movement, sleep. I'm going to spend a lot of time educating you. That's my job. I'm also going to tell you what I understand when it comes to the research around making changes with alcohol, substance abuse, the consequences of abusing certain foods, those kinds of things, and then really kind of point you the best direction. It's a lot of advice. Does that show up in the other relationships, coaching and therapy? Yes. I will briefly go into a consulting mode in those environments, but it's not the bulk of how I should be interacting with a client, okay? As a coach, you're going to tell me what your goals are. We're going to come up with a plan of attack, of action, and I'm going to help you figure out how to hyper-focus on reaching those specific or particular goals. And it's going to be very structured and oriented towards how are you getting in your own way, any kind of thinking patterns that we need to challenge, any kind of behavioral-oriented things that you want to look at differently. And I'll pull a little bit on the consulting hat or training to help you and give you some advice there, but mostly it's pushing and encouraging and supporting and helping you to see where you're getting in your own way, and helping you to uncover your best self, okay? And I do a lot of this coaching work when it comes to nutritionally guiding people and helping them to change their behavior with food and with movement. It shows up a lot in therapy. I even do something called coach therapy, okay? Because I am a cheerleader a lot of times, and I am somebody who's helping you to unearth things. Therapy is different. Pure therapy is about helping you to understand what's going on with your emotional relationship with the world, okay? And we look at how emotions are, they're like indicators. They're like getting into the car and lights start coming on and your car is trying to tell you something. Feelings are there to alert you to something, an alert system. And I need to help you uncover and understand where those feelings are coming from, what the alert is about, what we are to do about it, if anything, what thoughts you may be having that are creating emotional consequences for you, and ultimately maybe even behavioral consequences, and how to really change the behavior after we've unearthed what you're telling yourself and what's going on. And it looks at, relationships with parents. It looks at interpersonal communication, what's going on with people in your life. We do a lot of skill building around that. There's a lot of personal information that's obviously shared in therapy that wouldn't even show up sometimes when I have a consulting relationship with somebody. But we may start to touch on a little bit in coaching, and I start saying, you know what, you may not be an appropriate client for coaching. You may actually need to go into a more therapeutic role with me so that I can safely help you understand what's going on with yourself, because it's inappropriate for me ethically to behave in a therapeutic way with somebody who's a coaching and consulting client. I'm going to be honest, part of what happened for me over time with some of my fitness relationships was that it became boundaries became very unclear for people interacting with me, and they were kind of wanting impromptu therapeutic work, which isn't safe for either the therapist or the client. There's a certain level of trust and respect, and there's a certain way that you build a foundation, and I don't take it lightly when I sit with people and we dig deep and we look at stuff and we do that serious work, and I find out their most personal hurts and their deepest struggles and the things that they say to themselves. And I just had to make sure that there were appropriate boundaries. So part of the reason I shifted in some of my more fitness-oriented roles with Fit for Life was because people knew that I was able to do this, and they would pull on that, and that wasn't okay for us. And I personally needed us to all have good boundaries, and it's allowed me to do that. So I will do that even when I have a consulting client or a coaching client who I now know is really a great candidate for therapy. I hope that helps. This is a little bit longer video than I thought it would be. Definitely not a clinic minute. So I hope this helps to clarify the difference. And then when you reach out to me or my assistant, you know exactly kind of how I'm going to orient things with you. And then that also speaks to, what's private pay, what's not, what's covered under insurance, and those types of things. Consulting is not something that you use insurance for. And coaching isn't either. Coach therapy can be. And then therapy is something you obviously are able to use your insurance for. So I am Tiffany Brown Bush, and I am hoping that this helped somebody to clarify some of the different options available. FRL Integrative Therapy, please visit www.f4lwithtiffany.com and stay healthy.